Romanado. We're now going to begin with rounds of questions, starting with the Conservatives for 6 minutes. Mr. Lewis, welcome to the committee. You have the floor.
Well, thank you, Mr. Chair. An honor to be here this morning, first time on Health Committee, and probably one of the most unique opportunities for me as a member of Parliament to truly bring some experience to committee. And so with that, I will first and foremost say congratulations to Ms. Romanado. I'm so incredibly proud of you on so many fronts. You represent both volunteers and professional firefighters. As far as I'm concerned, they're the exact same. Smoke is smoke and fire is fire. And so I want to say thank you so much for bringing this very well thought out bill forward, a bill that I not only completely endorse, but I believe is so vitally important. And so I probably won't have a lot of questions for Ms. Romanado, but I do want to share a couple of stories. So over the last 5 weeks, I was at the Kingsville retirees. I was part of the Kingsville Fire Department, and I was at their retiree dinner. And I ran into a gentleman by the name of Mr. Vokes, Art Vokes. Served 32 years. He just retired about 2 years ago. 2 months ago. And Mr. Vokes shared a story with me in that he had no idea he was walking around with prostate cancer. And he did give me the permission to tell this story this morning. So he had no clue. And I didn't know this till this morning. So generally speaking, men are 0 to 5 prostate. He was at 19.1, Ms. Romanado. So he was basically walking dead what the doctors told him. Thank goodness, the doctors removed his prostate and saved his life. And he said, Chris, I think testing should be done for firefighters every 5 years, both firefighters that are working today and also the retirees. And that's just one example. The second example I would give why this bill, C-224, is so vitally important. I was at the Windsor Fire Retirees Dinner a month ago, and I sat next to the chief health officer, and he said, "Chris, are you aware that now Parkinson's disease has been linked to firefighting?" I said, "I had no idea." Right, and so the very folks that we rely on, that we scream for help, when the cat's caught in a tree, pardon the pun, our house is burning, or somebody is dying of a medical emergency, we're the exact same ones that go out there and run to the assistance and do it with service, no different than this house, right? And these are the same folks that I'm going to suggest are too embarrassed to even say that they're struggling through this, that they're fighting these illnesses. And if we can, at the very, very least, make January Firefighter Awareness Month, specifically to cancers, oh my goodness, that's about the biggest slam dunk in the whole world. I guess my question would be, through you, Mr. Chair, to Ms. Romanado, and I don't want to stall this bill. As a matter of fact, I wish this bill was done 8 months ago. Can I ask you, is there something else in this bill that you would like to see, perhaps, that would enhance even further your bill?
I know Christmas is coming, MP Lewis, and I think firefighters across the country want to see parliamentarians come together, as we have on this bill, to get this done. And so in terms of what would I like to see in this bill, I would like to see this bill passed for them. And I didn't say thank you. Thank you for your service, but also thank you for standing by me on this one and giving me counsel on this one as a firefighter. I want to thank you for that, because while my father was a firefighter and my husband was a firefighter, I did not serve. I'm a family of one, but having that firsthand experience and counsel has been enormously helpful for me, and I appreciate everything that you've done to help me on this bill. So if I had anything to ask for Christmas, it would be that this bill gets reported back to the House before we rise.
Thank you. Mr. Chair, how much time left, please, sir?
1 minute.
Thank you. And I'll just wrap up my thoughts here. So I'm gonna build on Ms. Romanado with regard to family. And so firefighters, we can't do this by ourselves. We come home from I'm going to say a long day's work, which everybody does, but carrying a whole bunch of stress and a huge load in our minds and our hearts. And I've said it before, and I'll say it again, and I'm proud to say it, because if I don't talk about it, then shame on me, right? I still get reoccurring dreams about car accidents that I've been to and you know, folks that we've pulled out of fires. So I'm not embarrassed to say it. It's the truth. The awareness that we are trying to pass here, specifically to mental illness, is there something else that maybe a new private member's bill or something else that we can do to support our firefighters, our families, but not just specifically to the firefighter themselves, but to the husbands and wives that have to live with firefighters, that have to sleep with firefighters, that wake up because, quite frankly, some of us are having nightmares. Is there something else that you can see? Thank you, Mr. Chair.
So I would say to that, I was very, very happy to be one of the first members of the government to support C-211, Todd Doherty's private member's bill in the 42nd Parliament with respect to PTSD for first responders. And I think showing cross-party support for PTSD for those who respond, whether it be military, firefighters, police, emergency responders, is vital. And I think we've demonstrated we can work together